Now, patients who have signed up for the liposuction surgery, they always ask us this question: is the liposuction fat going to come back after the surgery? Now, the answer to this is, if you maintain a healthy lifestyle, meaning that if you eat sensibly, eat in good proportions, and maintain your lifestyle by having a good physical activity and exercise routines, this fat is not going to come back. But however, once you get your liposuction surgery and you start feeling absolutely slim and toned down, you can get a little bit casual. Now, this complacency should not set in us once the liposuction procedure is done. So you have to maintain a good lifestyle, a good diet, adequate physical activity is enough for you to maintain this chiseled or sculpted or a slimmed body once the liposuction is done. So there is a maintenance to it. After the liposuction, you have to eat sensibly and you'll have to diet, you'll have to work out. Okay, now another question which is asked by our patients is, how much is the maximum amount of fat which can be removed from the body? Now, as physicians, as plastic surgeons, we have to keep the procedure safe, because liposuction is an elective procedure and it is done for a lifestyle, it is done for better shaping up. So you have to keep the surgery absolutely safe. Just because a patient comes to us, it doesn't mean that you have to remove liters and liters of fat. No. So there is a limit to removing this fat. Now, on the average, in a 65 kilo person, the amount of fat which is removed is around 5 to 6% of the body weight. So this actually comes up to around 4 to 5 liters. So this is a safe physiological limit. Now, when you remove it within this physiological limit, there is not going to be much of a problem. There's not going to be much of bleeding. There's not going to be much of fluid losses. The water content is kept well within balance, and hence the procedure is much safer. So that's what we want as plastic surgeons. We want to keep the procedure as safe as possible. So it is important that we remove fat up to 4 to 5 liters in the person. So not beyond this. There are patients who are weighing around 90 kilos or 100 kilos, and you can remove as much as possible, but expect a lot of complications once you resort to mega volume liposuction, like removing more than the 5 to 6% of body weight. So you can expect a lot of complications if you start removing more of body fat. So if you want to keep the surgery safe, stick to the limit of 5 to 6% of body weight, and on the average we remove 4 to 5 liters of fat. Many times we get requests for double chin corrections by liposuction. So patients come to us asking us, how long is it going to take for us to look absolutely normal after the liposuction? Yes, so because this is a very restrictive surgery to one area, the downtime is not really much, but however, for the complete swelling to settle down, it takes probably around 4 to 6 weeks before you can appreciate the contour of your jawline or the neckline after the liposuction procedure. So expect this much amount of time before you can actually start to shape up. A lot of patients ask us the cost of liposuction. Now this is a very difficult question to answer, because the costing of any plastic surgery procedure first of all depends on the facility which it is being done. Now facilities, if you look at India, they're being done in nursing homes, in standalone units which could be exclusive cosmetic surgery centers, or they could also be done in corporate hospitals and bigger hospitals. Now, bigger the infrastructure, obviously the costing is going to be higher, and smaller the infrastructure, the overheads are going to be less, and hence the costing can be less. Now, the other thing which determines your costing is also the experience of the surgeon. Now, there are surgeons who are very well experienced, and they would probably charge for their professional fee and their expertise. So it also depends on the expertise. Now, somebody who could be really well trained and who who must have spent a lot of time training with the best of the best in the world, and this probably this particular surgeon would be charging you a little more for the procedure. Now for the average, let's keep it, if you want to do one body part, let's say the abdomen, in a nursing home kind of a setup, it would be costing you probably between 80,000 to 1 lakh if you want to get your abdomen and the flanks being done. But the same procedure, if it's being done in a standalone center or a cosmetic surgery unit, it could cost you up to around 1.5. Now this procedure, if it's done in the corporate, could be costing you a little more, between 1.5 to 2 lakhs of rupees. So similarly, you can extrapolate the costs when multiple areas are being done. So when multiple areas are being done in a nursing home setup, it could cost you around 1.5. In a standalone unit, it cost you 2, and in a corporate hospital, it cost you 2.5 to 3 lakhs of rupees. Many of our patients who seek liposuction, they have this curious question: how can the fat be removed? Now this is a very valid question, because as patients, they probably think that when they're coming to a surgeon, the surgeon is going to cut open and then remove the fat. But it's actually not liposuction is not a highly invasive procedure. So there's no cutting around when we remove the fat. Now how is this liposuction performed? Now as plastic surgeons, we use blunt instruments called cannulae. So these are hollow cylindrical tubes, stainless steel tubes of adequate length and diameter, depending on which part of the body we need to suck out the fat. So we introduce these cannulae into the body depending on the area which has to be liposuction. Let's say the abdomen has to be liposuction, so we introduce it through hidden incisions, pass it into the fat layers, and start making to and fro movements. Now when we introduce the cannulae, these cannulae are attached to a suction machine via tubes. Now there is an amount of suction which is necessary to suck out the fat, and by the to and fro motions, the fat is sucked out. Now before doing the fat aspiration, we have to liquefy the fat. Now liquefying the fat happens by introducing a solution called tumescent fluid. Now you must understand that the fat is really compact in the body. So when you start doing this suction out, it will not come out easily. So you have to break this fat down. You have to liquefy it by introducing the tumescent fluid. Now this tumescent fluid not only liquefies the fat, but it also has a chemical or a substance which causes the blood vessels to shrink. So there is not much of bleeding. So this is very important, because we'll have to keep it really safe. We don't want any blood loss. So blood loss is minimized by giving adrenaline into the tumescent fluid, and we liquefy this fat, and then we start making to and fro movements, and then we suck out the fat according to the excess or what the patient wants to shape up as. Now a frequently asked question is, how long do the results following liposuction last? Now the simplest answer to this is, as long as you maintain your lifestyle by way of dieting and by way of exercising, the results can be lifelong. So fat, once it's removed, a fixed permanent number of cells are removed. So meaning that if you maintain your lifestyle, if you maintain your body weight, the results can be just permanent. They don't need to, you don't accumulate fat once the liposuction is done, but you'll have to maintain, you'll have to work towards it. But however, if you start eating, if you start maintaining an erratic lifestyle, you don't exercise, you are very inactive, then obviously the fat is going to come back. So after liposuction, maintain a good physical activity and maintain a good lifestyle, maintain a good diet for the results to be really long lasting. The types of liposuction in the modern day, there are 3 types of liposuction. One is the conventional liposuction, which most of you would be knowing. This is a technique where you introduce the cannula into the body, and the fat is actually liquefied, and then by way of a liposuction cannula and a machine, the fat is sucked out. So this is the conventional liposuction. It's been going on for the last 20, 25 or maybe more number of years, and by and large followed by many centers across the world. But technology has improved. You have a lot of technology coming up to help in tackling the fat in terms of melting the fat and in terms of being very specific to the fat. So you have ultrasonic assisted liposuction, where ultrasound or heat waves are passed into the body, and the fat is selectively targeted, and this fat is again sucked out by the cannulae. And so this is the second technique. Now the third method is called the radiofrequency assisted liposuction, where you give radiofrequency waves and pass the radiofrequency energy into the body, and this kind of melts the fat, liquefies it further down, and then with the help of cannula you suck it. The additional advantage of using the technology would be to gain shrinkage of the skin. So whether it is ultrasonic assisted or the radiofrequency assisted, you get a lot of skin shrinkage with the technology used. So conventional technology doesn't actually deliver the heat, so you cannot expect much of retraction. But with added technology, with ultrasonic assisted liposuction or the power assisted or the radiofrequency assisted liposuction, you can get a lot of skin shrinkage following the fat reduction. So this helps in actually shaping up, and this is what has led to newer surgeries like six-pack surgeries or the 3D liposuction. So this is what is making patients drawn towards the technology because of better results. Another frequently asked question is, which type of procedure removes the most fat in liposuction? Now you know that there is a conventional technique of liposuction which involves introducing the cannula into the body and sucking out the fat. Yes, this is a good method to remove the fat, but when it comes to redo surgeries, or when it comes to back part of the body which has to be liposucked, or very fibrotic areas, very hard areas to be liposucked, this is where the technology comes into play. The ultrasonic assisted liposuction is far effective and efficient in tackling the fat. So because these ultrasonic waves are very specific to the target cells, the fat cells, they focus only on the cells, and these cells actually break down, and it's very easy for the surgeon to remove the fat. So stubborn areas, especially the back, and you have even the love handle. Sometimes in males they can be stubborn. Gynecomastia surgeries, they can be very stubborn to tackle it by the conventional method. So ultrasonic assisted liposuction can play a huge role in making a difference in the overall result. And a lot of patients actually come back for repeat procedures. So we call them the redo surgeries. So especially in redo surgeries, the ultrasonic assisted liposuction plays a huge role. So this is where the technology comes into action for plastic surgeons.